All right. I think we'll go ahead and get started here. Hi, everyone. Thank you for joining us. My name is David Cadena. I'm the medical director of our Hill Country Clinic in Bernie, Texas, actually, but still UT Health San Antonio. This is our first webinar for our Healthy Living series that we've been hosting from our UT Health Clinic. And today we're actually having a speaker, Dr. Arlene Reyes, on lung cancer screening and prevention. Every quarter, we try to do a healthy living seminar, and we're moving to this webinar format. So thank you all for joining our first one here. Dr. Reyes is actually a primary care physician here at the Hill Country Clinic who's board certified in family medicine. She trained locally with the Health Science Center here in San Antonio and then joined our primary care practice out of residency. She has a special interest in lung cancer screening and is currently helping lead a joint project with the American Cancer Society to improve our own lung cancer screening efforts. So Dr. Reyes, thank you for presenting today. I'd actually like to hand it over to you to start presenting.
Okay, sounds good. Hi, everyone. Again, welcome to this month's Healthy Living Seminar. I'm so excited to talk to you today as we wrap up Lung Cancer Awareness Month for the month of November to discuss lung cancer screening and prevention. Before we get started, I'd like to point out that we do have a chat box, and please feel free to submit comments or questions throughout the webinar. I'd like to engage with you as much as we can. So my co-host, Dr. David Cadena, will be keeping an eye on the chat box so that we can address questions as they come in. We'll also have time at the end to address any questions you might have if you didn't have a chance to ask during the webinar. So let's get started. I'm going to start with saying it's safe to say that likely most of us, if not all of us, have been affected in one way or another by lung cancer. Perhaps you have a friend or a family member that you know that has been impacted in some way by lung cancer. And I'd like to share a little story with you about my own personal experience. This is a photo of my family, and the glowing young woman you see in the middle is my mother. She is cradling me, surrounded by family, not long after we had arrived from the hospital, a few days after I was born. And flanking her are my beautiful grandmothers. Sadly, they each passed away when I was very young. One of my grandmothers passed away from breast cancer and the other from lung cancer. And I never had the pleasure of getting to know them or building a really close relationship, but I've heard stories of how wonderful they were, and I hold them dear and near to my heart. My daughter, who is now 8 years old, she has the most precious relationship with her grandparents. She is practically joint at the hip. I say this all the time, on each side to her grandma and grandpa, and they spoil her rotten, as they rightfully should. Her grandfather has a long history of smoking, and 2 years ago, he made the very personal decision to quit smoking. With the help of his physician, he did successfully quit. And since then, he's been getting his annual lung cancer screenings done every year. We'll talk about that a little bit more in the talk today. He does have a lung nodule that we know about, but it's being monitored closely. And I take comfort in knowing that if he were to develop lung cancer, it would likely be discovered early at a point in time where treatment is more likely to be curative. And my daughter would be able to enjoy her sweet relationship with her grandfather for years to come. For this reason, I'm very passionate about sharing information with my own patients and with my community about the importance of lung cancer screening and prevention. So with that said, let's jump right in. So what is lung cancer? As you can imagine, lung cancer is a type of cancer that starts in the lungs. And cancer starts when cells in the body grow out of control. Lung cancer is the third most common cancer in the United States. However, it is the most common cause of cancer-related deaths in the United States, more than female breast cancer, prostate cancer, and colon cancer put together. Despite that, our lung cancer screening rates are very low in the United States. It's about 5 to 6% across the US, and even lower in Texas, even knowing that lung cancers are the most common cause of cancer-related deaths. There is several different types of lung cancers that can be categorized into two different groups. One being non-small cell lung cancer and the other small cell lung cancer. Non-small cell cancer is about 80 to 85% of all lung cancers, and those are further divided up into a few other subtypes that you can see down here: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Small cell lung cancer is about 10 to 15% of all lung cancers, and it tends to spread and grow faster than non-small cell lung cancer. And it's the cancer that we see the most in those individuals who smoke. Symptoms of lung cancer are not usually experienced until later stages when lung cancer has likely spread. Typically in early stages of lung cancer, you have no symptoms, and that's why it's important to get lung cancer screening if you meet criteria, and we will talk about that later on in the talk. But some symptoms of lung cancer can look like a nagging cough, shortness of breath, losing a great deal of weight unintentionally, coughing up blood, and unexplained chest pain. So I alluded a little bit to this, but causes of lung cancer, the most common cause by far is smoking tobacco. About 80% of lung cancer deaths are caused by smoking, and many others by exposure to secondhand smoke. Specifics when it comes to tobacco smoke: obviously, the longer you smoke and the more packs a day you smoke, the greater your risk. Cigar smoking and pipe smoking are almost as likely to cause lung cancer as cigarette smoking. Smoking low tar or light cigarettes increases lung cancer risk as much as regular cigarettes, and smoking menthol cigarettes might increase the risk even more, since menthol may allow people to inhale more deeply. If you don't smoke, breathing in smoke of others can increase your risk of developing lung cancer. Secondhand smoke is the third most common cause of lung cancer in the United States. And if you're wondering what the second most common cause, it's radon. So radon is actually a smokeless, odorless gas that can be found in the environment all across the US. And typically exposures can be from high levels in the homes. You can actually pay a service to get your home tested for radon levels to ensure that the levels are safe. Other causes of lung cancer are air pollution, workplace exposures to asbestos or diesel exhaust, and certain other chemicals related to workplace exposures. E-cigarettes are also known as vapes. They are a type of electronic nicotine delivery system. Most e-cigarettes contain nicotine along with heavy metals and volatile organic compounds that, when heated, can actually turn into formaldehyde, which we know can cause cancer. E-cigarettes are fairly new, but more research is needed to know what the long-term effects might be. So for that reason, they're unproven and uncertain as of right now. So what can you do to prevent lung cancer? Well, the most important thing you can do is either to not start smoking or to quit if you do smoke. Avoid secondhand smoke, make your home and car smoke-free. Get your home tested for radon. The US Environmental Protection Agency recommends that all homes be tested for radon. But you have to pay for this out of pocket. So not a lot of people do this. And be careful at work. Follow health and safety guidelines to avoid carcinogens. Carcinogens are cancer-causing chemicals. If you do smoke, tobacco cessation is a really powerful way to prevent and minimize your risk of lung cancer. No matter what your age or how long you've smoked, quitting can lower your risk and help you live longer. If you stop smoking before cancer develops, your damaged lung tissue gradually starts to repair itself. And smoking, we know, is a tough opponent. It can take several attempts to quit smoking, but with the right help, you can definitely be successful. And a good place to start is with your provider. I have a link down here that would take you to the American Cancer Society website that talks about some easy ways to get started today if you're interested and ready to quit smoking. I'm not going to click on it, but we do have some resources for you at the end of the webinar that we're going to attach in the chat box. So what is lung cancer screening? Well, let's start with what is a screening test, first of all. A screening test is a medical evaluation used to find a disease or to see if someone is at risk of developing disease. The screenings are performed in a group of people who are at greater risk of developing that disease and who are without symptoms. So that's the big catch. You do not have symptoms yet, but you're at increased risk. So we do or offer the screenings. What is lung cancer screening? So lung cancer screening isn't just a test. It's more of a program. And it includes first counseling and a shared decision-making visit with your doctor, your healthcare provider. Once you have that visit and that counseling, if you decide that, yes, you're at increased risk together with your doctor, and you want to proceed with the screening, a low-dose CT scan is ordered. Your doctor or healthcare provider will help to manage the test findings. And if you are smoking, the program can also help those who still smoke to quit. So reasons to screen people at higher risk for lung cancer. Kind of touched on this earlier, but symptoms don't appear until the disease is already at an advanced stage. Found at an earlier stage when it is small and before it's spread is more likely to be treated successfully. When found and treated at earlier stages, survival rates increase from 6% to 60% at 5 years. So who should be screened for lung cancer? So this slide is a little bit busy. I just want you to turn your attention to the blue box here. But basically, if you are between the ages of 50 and 80 years old, you are a current smoker or have quit smoking in the past 15 years, and you have a 20-pack year history or greater of smoking, you would meet criteria for lung cancer screening. Now, a 20-pack year history of smoking could also be equivalent to half a pack a day for 40 years, or a whole pack or 2 packs a day for 10 years. One of the handouts we're going to put in the chat box at the end of the webinar, it has a calculator on there to kind of help you if you want to see if you would meet criteria. Let me know if there's any questions so far. Happy to answer them. I'm going to keep going. So a low-dose CT scan, as we talked about, can help find abnormal areas in the lungs that may be cancer. And getting a yearly low-dose CT scan before symptoms starts helps to lower the risk of dying from lung cancer. So not only is it a one-time CT scan, but it's done annually until you no longer meet criteria for screening. How is this screening performed? It's a pretty easy test. You lie on a thin, flat table that slides back and forth inside the hole in the middle of the CT scanner. It's painless, and it takes just a few minutes. You don't need to swallow anything. There's no involvement of contrast dye, and it's very easy to do. Now, with any screening test, there is potential risks, and those are important to talk about. One of the risks includes additional testing that might be necessary. There may be lung nodules that can be seen on a low-dose CT scan. That's what we're looking for. So your healthcare provider may want to take another look at these if you have them, and you may even require a biopsy. There's also the potential for false positive. So a lung cancer screening test can suggest that a person has lung cancer when no cancer is present. This is called a false positive result. And false positive results can lead to follow-up tests and surgeries that are not needed and may have risks. And lastly, the radiation exposure. Now, low-dose CT exposes you to a small amount of radiation with each test. It's about the same as 15 X-rays or 50 cross-country flights or 6 months of natural background radiation you're exposed to on a day-to-day basis. A low-dose CT scan is less than the dose from a standard CT scan. So the risk is minimized with making the radiation a little bit lower than a standard CT scan. I think I see 2 comments in the chat box. Is that for us?
Those are some of the fact sheets and more lung cancer screening information.
Perfect.
But,
I just wanted to make sure because I can't look.
No, that's okay. But I think you're making a good point about the CT scans. Now, I think we've had a lot of patients come in before and they say they're fine because they had a normal chest X-ray, right?
Mhm.
What do you tell those patients that feel like the X-ray that they've had done before has given them some reassurance?
Well, chest X-ray is actually not recommended for lung cancer screening. The recommended imaging modality is the low-dose CT scan. It's more accurate and can find smaller nodules and abnormal findings than a chest X-ray would be able to. That's a good question. Thank you for asking that. So when should screening stop? So at some point, screening can and does stop. You'll continue yearly lung cancer screening until you turn 81 years old, or have not smoked in 15 years or more, or develop a health problem that makes you unwilling or unable to have surgery if lung cancer is found. So that's basically the summary of lung cancer screening and prevention and why it's so important. And so some big takeaways for you today. I have 4 basically bullet points here. Lung cancer screening is the most common cause of cancer-related deaths in the United States. The most common cause of lung cancer is smoking. It's more likely to be treated successfully when found at an earlier stage with a screening low-dose CT scan. And the most important thing you can do to prevent lung cancer is to not start smoking or to quit if you do smoke. I'm going to open it up to questions if there are any, but that's basically it. It's a quick run through of lung cancer screening and prevention 101. If you have more questions after the webinar and you're wondering if you meet criteria, make an appointment with your doctor and have that discussion. They can definitely help provide you with some guidance and what the next steps would be if you do meet the criteria.
So if you have additional questions, go ahead and put them in the Q&A or in the chat and we can read through them. Dr. Reyes, as far as, I know you said the biggest thing is kind of not smoking or preventing smoking. What do you suggest to people as the first step in trying to stop smoking who haven't tried yet?
Yeah, so the first step I'm going to say is just, first of all, just making that decision to stop smoking. You're more likely to succeed when you feel like you're ready to take those steps. And the second step would be to consider, making that appointment with your doctor to see what resources there are available to help quitting. Now, your doctor can discuss with you various treatment options. There are several available, and it also depends on what you've tried in the past, if you've tried attempts before, and based on what has worked for you or not worked for you in the past, you can decide what to try next. But there's some options like nicotine replacement therapy with transdermal patches, gums, nicotine gums, lozenges. There's some medications that can be prescribed to help reduce cravings. And UT Health actually has a really great resource called Quit Text. And Quit Text is a free service to UT Health patients. It's basically access to a 24/7 quit coach, much like a personal trainer that you would have at the gym. You have a quit coach that you could go to while you're working on decreasing your tobacco use and planning for and preparing for your quit date. And it's easy to enroll. If you have any questions, you of course, discuss with your doctor how to enroll. They can get you some details on that. But it's basically signing up via text messaging. And it's really great because it helps you kind of get through potential triggers. If you feel like, hey, I'm having a bad day, I want to pick up a cigarette. What can I do? And you text your quick text coach, and they kind of help you walk through what you could do to avoid kind of falling into the traps of triggers or cravings. I think it's a great resource that we have available to our patients. And if it's something you're interested in, I would definitely take advantage.
What has been the top reservations for patients that you've worked with in not wanting to get screened or not wanting to do the CT scan?
Yeah, I would say, a big one is the fear of finding something. And I think it's just a matter of, having that shared decision-making conversation with your doctor and helping you to kind of figure out, what are my values and what are my goals? If you would want to know if you have lung cancer or something that should be followed, and if it is cancer, you'd want to be treated, it would be a good idea to get the lung cancer screening. The sooner, the better, because like we've said before, the earlier we catch these things, the easier it is to treat and the more successful we are at treating it. I would say also maybe some barriers would be the cost, but if you meet criteria, lung cancer screening is covered by insurance. And I think also not knowing what to expect with the imaging itself in the process of getting the low-dose CT scan completed. But, whatever questions you have and whatever apprehensions you might have, just be open and honest with your doctor, because I guarantee that they'll be able to give you some information and maybe provide some comfort in whatever fears or apprehensions you might have.
Yeah, that sounds really good. I think one of the fears, you're right, it's I don't want to know kind of thing, and that's hard to overcome, I think. But like that's with all cancer screenings. And one of the things on your slides mentioned was false positives. That's not, I just want to make sure that everyone knows that's not necessarily unique to this kind of test, right? All labs we do, all imaging we do, any other kind of cancer screening, such as a mammogram, they all have false positive, false negative rates that are just built in. That not everything's perfect, right? So that's not something that I want to deter people, but I'm glad you brought it up, because that's part of any kind of cancer screening.
Exactly. That's a great point. Thank you for bringing that up.
Yeah, but that was a fantastic overview. There was just one question in the chat about recording this, and it looks like Taylor responded about it's going to be recorded, this webinar. There'll be a link sent to everybody as well. And the other question on our chat is, are people who breathe in secondhand smoke regularly more likely to get the same diseases as smokers? And there's a second question to that. Do you want to take that one first?
Yeah. So exposure to secondhand smoke, especially chronic exposure, does increase your risk of lung cancer. It's actually the third most common cause for lung cancer. The first being actually to smoking cigarettes. What was that second part?
The second part to that is, how much passive exposure would qualify for lung cancer screening?
Yeah, that's a good question. And that's a hard one. So it's hard to measure that, right? But we go based off of the criteria that was mentioned earlier, and it's really based off of smoking cigarettes. Do you have a better answer for that, Dr. Cadena?
I don't think that there's a formal a formal threshold that you can get lung cancer screening as a passive smoker through your insurance. I think you're right. It would be a shared decision with whoever the doctor is that could order that for you. So that's kind of uncharted territory. That's not a great answer. And some of these things they come up to with people who are vaping or cigar smokers. Those numbers aren't perfect. And I would say with passive exposure, it's even more difficult.
Mhm,
Yeah,
mhm.
so that's a hard question to answer, but the best bet is that shared decision making that you mentioned.
Exactly.
Yeah, and somebody else was asking, how do we get the quick text information? And we're going to put a link in the chat there, but also just talking to your primary care provider, you should be able to get access to that.
Mhm.
I don't see any additional questions, but we really appreciate your talking, Dr. Reyes. That was a fantastic presentation, and I think I learned a few things too. So thank you so much.
Great. It was a pleasure. I hope you all feel like you took something away from this. If you have a friend or a family member that you think might be at increased risk, I would recommend, sharing this information with them if you feel like they're ready and open to hear it. Because we need to get a lot better at doing a lung cancer screening for our community. And just raising that awareness is one of the first steps.
Thank you. We will continue to have quarterly seminars like this through a webinar format, and we'd appreciate any feedback on the survey we will send you to think about other topics you'd want to learn more about, part of this healthy living seminar. But thank you so much for attending, and again, the recordings will be sent to everybody. Thank you. We appreciate it.
Thank you. Have a good night.